Thank you all again for joining today's webinar. We are in week 7. Congratulations for making it this far. We are almost at the tail end of the academy. So thank you so much for hanging in there and attending all the webinars. We really appreciate you for your active participation in this year's academy. And today we are in week 7 of the academy, and we are talking about monitoring and evaluation, NGO, CBO focus. So we are measuring success and indicator development for NGO and CBO focus. And today we are honored to have our presenter, Mr. Boaz Odawa. Boaz is a seasoned data analyst and statistician with over 8 years of experience in transforming raw data into actionable insights that inform strategy, improve program performance, and drive measurable impact. He's highly proficient in more than 14 digital data collection tools, including Savvy CTO, Kobo Toolbox, ODK, SSP, among others. There's so many, but he has a lot of experience in the different data collection tools. Boaz is an experienced trainer who equips teams with practical skills to collect, manage, and interpret data effectively. He is deeply passionate about the role of predictive analysis, and he helps organizations and community-led initiatives harness the power of data to unlock growth, increase accountability, and enhance long-term impact. With that introduction, I'll allow Boaz to please take us through the academy. Welcome, Boaz. You're muted, sorry.
Okay, sorry. Thank you so much, Joyce. I'm honored to take the team through this particular session. I'm Boaz Odawa, as mentioned, and I'll just take the next few minutes and hours and an hour to take you through this particular session. Thank you. I'll share my screen for the presentation purposes. And I'd like to mention that I'm really honored. First, good evening, everyone, those who got an opportunity to join this particular webinar. I'm glad to be your speaker today. And for this particular week 7, we are going to focus more on measuring success and indicator development for CBO. And when we talk about measuring success and indicator development for CBO, there are a number of things that I'd like to mention. This is an area that really fascinates me and really is a key area for me because it's the backbone of a strong community development work. And it is more because it helps us first prove our impact, 2, it improves our work, and 3, it helps us to communicate the results convincingly to donors, to our partners, and equally to the community that we serve. So over the next few minutes, I'll just take you through what M&D is, why M&D is important, how to measure success, how to develop strong indicators, and how to use data to inform decision-making. And I'll also try to first measure on what are some of the best practices for CBOs and for M&D. And we also discuss what are the challenges that CBOs face in M&D, and what are the strong indicators that we need to use. How do you use it? How do you use data? And for what purpose? And for what particular reason do we use data for M&D? The first slide talks more on the introduction, and I'd like to introduce what M&D is. And if you look at the introduction that I've just given for M&D, I've tried to differentiate what monitoring is vis-a-vis what evaluation is. And let's begin by just grounding ourselves in what we mean by monitoring and evaluation. Monitoring is basically about tracking progress. And when we track progress, we try to track progress as something goes. It is a continuous process of just collecting data to see if that particular project activities are on track or if there is something that's lagging. So we need to think of it like a project tracking base. It's like a GPS, a geo point for a particular project. So it tells you where you are as an organization, how far you've gone, and whether you need to increase the pace, head in the right direction, or you are losing direction. So for instance, if you're running, for example, a youth empowerment project, monitoring could mean involving just tracking how many youths have attended that particular training session, how many have started small businesses after that particular session, and how many, for example, have completed mentorship based on the program that you've given. When you now look at the evaluation bit of it, on the other hand, is more of looking back to see how well you did. Not tracking the progress, but looking back to see how well you did. We try to assess more on the effectiveness of that particular project, the efficiency, the impact, and just the overall activities throughout that particular project, the evaluation. It's not just about the process, but also about the result. So for the same youth project that I talked about, where we are measuring more to let us know on the training session that they have attended, the people that came for the training session, the people that completed the mentorship programs, for evaluation, we are trying to ask ourselves questions like, did this particular training session actually improve the participants' knowledge? Did it improve the capacity of the applicants, of the participants? And even after completing those particular programs, are the participants' employability or the income levels increased? That's how we differentiate the monitoring bit and also the evaluation bit when it comes to M&T. Next is more on the definition of terms and their importance to M&D, especially when it comes to CBOs. And I'd like to mention why M&D is so critical, especially for CBOs, the community-based organizations. You find that these organizations operate very close to the grassroots. And when they operate very close to the grassroots, they deal with real people and also the real challenges that these people face on a daily basis. Whether there are issues that pertains to health, to education, to livelihood, to social change, to their political environment, to their economic status and livelihood, M&D help us to measure their contribution and also communicate to us well effectively on how this should be measured. So it helps us demonstrate more on the impact and see, when we talk about impact, we also see, try to also want to see how about the results. Yes, there are impacts, but how about the results, what we call the outcomes. So when you can show, for example, what your nutrition project, if you have a nutrition project, has had in the reduction of child malnutrition, we ask ourselves by what percentage? Is it by 20%? Is it by 10%? Or is it by 5%? So you build trust based on the credibility, based on the results, and also based on the numbers that can be justified. Second, M&D also help us as a guide, because it guides the program development and also the improvement. It tries to help us highlight more on what is working and what is not working. So if a certain intervention or if a certain activity or a project or a program is not giving credible results, then monitoring bit of it can help us identify it early and improve us and help us into improving and even adjusting our approach before it gets late. Third, M&D is also key in securing funding, because donors would want to fund results, and they also want to fund something that they can not only promise them, but they can also see the actual result from it. So if you can present that result in a clear, backed by the data, it's a data-driven evidence of success, then you'll have to have a stronger case for a future funding, and this is backed by M&D. Finally, M&D help us in fostering accountability and learning. And when we talk about accountability and learning, it tries to ensure that the resources that are being used are used well. There's accountability for it, and the lessons that are being captured are captured for future planning. So let's look at some of the key concepts of measuring success. On the key concepts of measuring success, and here we look at the definition of success. And how do we first define what a success is? For a CBO in this particular instance, success goes far beyond just financial sustainability, because when we talk about success, most people try to look at the finance bit of it. It is about achieving your mission when you talk about success. Has the mission been achieved? And it's also about making a measurable difference in the people's lives. Has there been any impact, whether it is a social impact, whether it's a community impact, a political impact, or an economic impact? But how do we measure this particular success? So you measure success through achievement of particular objectives that were set for a given program or a given project. So for instance, if you are looking at about the women empowerment program, we try to look at has it actually increased the number of women earning an income? If yes, then that is a success. So you look at more of a community impact. Has there been a change in the well-being in terms of education, in terms of the health outcomes? It's a yes or no. And finally, we also look at the sustainability aspect of it. Can the project continue to bring benefits even after this particular external funding has ended or has exited? Yes or no? If it is yes, then this particular program or a project has a sustainability aspect of it, and that's a success. So remember, success must be measured both quantitatively through numbers and data, and also qualitatively through stories and case studies, based on the perceptions, based on the experiences, based on the lived experiences. And numbers can tell you what happened, because it's more of being quantitative in nature, but qualitative aspect of it help us to know the perceptions, the experiences, and also the story behind why it matters. The why, the when, the where, and the how. That's now observable. It's a qualitative in nature. So when you look at the roles, and here we are looking at the roles of, sorry, let's look at the roles.
Yeah, beyond the role, beyond, yeah, just move one, yeah, that way.
Yeah,
That's the slide. Yeah.
yeah. And when you look at here, there are a number of things that we need to look at. And here, majorly, when we define success in the context of CBOs, we try to unpack success, actually defining it in a community-based context. And at the top of it all are the goals. And at the goals, these are just the bigger picture of dreams. We look at the long-term change, what we want to see. For example, when you look at the goal, a goal could be something like to improve access to education of children in a rural area. That's our goal, and it's a broader goal. So you realize that most goals are normally broad and complex in terms of being ambitious. Some of them are very inspiring in nature. So it is we normally call it the goal is the North Star in M&D. A goal is like a North Star, very broad, very ambitious, and very inspiring. But then we have the objectives after those goals. These are just specific measurable steps that help us achieve that particular goal that was now broad. We now call them the objectives. For example, we talk about now improve access to education for children in rural areas. The objectives now could be to enroll 500 students in a rural school by the end of the year. So we are now trying to be specific on the number of students, the number of people that we want to enroll, a specific school, and also a timeline. So goals give you more of a direction, but now the objectives give you more of a focus. They allow you to track progress, they allow you to allocate resources wisely, and they also allow you to even celebrate milestones based on the things that you've now achieved. So without clear objectives, it becomes almost impossible to measure a success. And you can really tell if your CBO is making progress unless you know exactly what you want to achieve. And by knowing what you want to achieve, then in M&D, it's called the clarity of power. It is more on that everything that begins with a well-defined goal and a clear objectives. So let's look at the SMART objectives for measurable outcomes. And here we are looking at now more on the SMART objectives. And looking at the SMART objective for measurable outcomes, you'll probably see that you've heard more about the SMART framework. And the SMART framework majorly deals with, in M&D, it deals with the specific for M, the measurable for M, the specific for S, the measurable for M, the achievable for A, the relevant for R, and also the time bound for T. So that's how an objective should look like. These 5 principles transform vague intentions that are normally very broad, that are normally very inspiring, into now actionable goals. So for your goal to be actionable, then you must have a very smart objectives. So, and that by having a smart objectives, it makes it easier for your indicators, because you are going to design indicators, you are going to track progress, you are also going to evaluate impact, and also just help you motivate your team, because everyone knows exactly what success looks like. So whenever you are designing project objectives, check them against the SMART test. If any of those 5 elements are missing, then you have to refine that particular objective to be crystal clear. SMART, specific, measurable, achievable, relevant, and also time-bound. This particular slide is more on the introduction of indicators. And on the indicators, we are going to look at more on the types of indicators. So what's an indicator? Before we even look at the type of indicators. An indicator are simply signals that allows us to show whether the progress is being made or we are stagnant. So these are measurable pieces of evidence that help us to assess performance. Think of them as more of your project scorecard when you talk about indicators. If your goal is to improve a community health, then your indicator could be more of the number of children that are being vaccinated, or the percentage reduction in the malaria cases or precedences, or in that particular area. So that's are the indicator. They have to be measurable. You have to be very quantifiable to help us know which particular indicators now directly respond to your objectives. So let's look at the type of indicators. When you look at the type of indicators, there are several types of indicators, and the most important to understand is how you differ, because these particular indicators differ from one another because they serve unique purposes. First, we have the quantitative indicators. And when you talk about the quantitative indicators, anything that is quant, we talk about the numbers, and they are measurable. Data has to play a key role. For instance, the percentage of girls enrolled in a school, or the number of trees that have been planted. Those are quantifiable indicators. Qualitative indicators. These are indicators that capture perceptions, they capture more on attitudes, and they also capture more on the opinions of respondents. So for example, we talk about the community members' satisfaction with the health services, or the confidence levels of community members among the women who have attended training. So this is more of a perception, this is more of an opinion. Then we also have the process indicators. The process indicators measures more on the activities and also on the efforts, because it takes time for us to reach a certain destination. So it's a process. So for the process indicators, these are things like the number of community meetings that have been held. They normally occur in a given sequence or a given process, or the number of staff that have been trained through within a period of time. We also have the output indicators that are more like process indicators, but these ones now measures more the immediate results of your activities, the output indicators. For instance, the number of households that have been reached with clean water. You count the number of those particular households. For a given period of time, it was a process, but now what are the immediate results? Then there are now the outcome indicators. Outcome is more of result driven, more of what are now the results of those particular objectives. So this measures the actual changes that have occurred, but they have occurred also, they have resulted from your work. For example, the percentage increase in the number, the household income, for example, or the reduction of child mortality or malnutrition in a given area. So they are specific, but they are result oriented. In short, process indicators track effort. Output indicators try to show what you produced, but the outcome indicators show what changed as a result of that particular activity. That's the difference. When you look at now the characteristics of good indicators also have to be smart. And not all indicators are created equally. No. A good indicator should always be smart in terms of being specific, in terms of being measurable, in terms of being achievable, R for relevant, and also T for time bound. And when looking at this, when you look at improving education, for example, if you talk about an indicator like improving education, it's very vague because by saying increase primary school enrollment by 10% by the end of 2025. Very specific and equally measurable. We measure it by the increase by 10% and also equally very specific. So one of the key indicator of a good indicators is that it has to be very smart. It has to be very smart in terms of being measurable. It must have a specific time by the end of 2025. At the same time, it's time bound because we've given it a time period, and equally very relevant because something that can be achieved. Is it really achievable? Then it must be also very realistic because if your CBO has limited resources, for example, targeting a 50% increase might be overly ambitious, for example, but a 15% or a 5% could be more achievable. And you also look at the timeline. It's a 5% in an year, very achievable. But a 15 or a 50% in a period of 6 months is ambitious and also unrealistic. So it has to be very realistic. Indicators must also be very relevant because they should align with what you are trying to achieve. If your project is focusing more on nutrition, then you shouldn't be tracking school attendance. You should be more specific to what the thematic area or the result area you're working on. If it's more about reduction in gender-based violence, then more on GBV. About wash water usage, hygiene practices, and also sanitation. If about reduction school enrollment, the theme should be education, and that's what you should be measuring. So indicators should relate more to the objectives and equally to the goals. They should be having that particular sequence. Again, lastly, they should be very time bound because indicators has to give more of a clear time frame because these help us more in tracking whether are we making progress or we are lagging behind. Are we within schedule or we are still lagging behind? So good indicators in general make your WMI work very easy, sharp, and equally very focused because it is easier for you to communicate results in a given way. Apart from looking at now the key characteristics of good indicators, let's also look at how do we develop indicators for CBOs, developing the process of developing indicators. Yes, they should be smart, but how do we develop them? So how do we actually create indicators? A step-by-step approach on how we create indicators. The first thing is that you start by the goals at the top, very broad, then you move to the objectives. For instance, if your goal is to reduce youth unemployment, then your objective might be you have to train 300 youths in some job skills within a given time period, like a year. That's training, that's the objective. Then the second thing, you have to decide what needs to be measured. Do you want to measure how many youths have been trained within that particular period of time? How many actually got employed afterwards, now post-training? And the third thing, try to set those indicators that track each level of progress. The input, the activities, the outputs, and finally the outcomes. For example, if you talk about the output, then this is now the number of youths that have been trained. Capture that as an indicator. That is an output indicator. These people are trained within a certain period of time. It's an output indicators within an process indicator because it took some time. Now the outcome, the percentage of trainees employed within 6 months. That's now the outcome. What were the results after that particular training? Fourth, we also need to define the data collection methods, maybe through surveys, through the interviews, and also through the training records. And finally, you also have to establish a baseline and a target. A baseline and a target. We normally say the baseline is at 0, but what is your target? If youth unemployment by the time you are starting this was at 5% or is 40% now, then your target is to reduce it to 32% in a period of maybe 1 year or 2 years. You now have to have a clear measure of this particular progress, and also it has to be time-bound. So that's how indicators come alive by just making them become clear. They have to be very logic, and equally, you don't have to guess. Next is the key performance indicators, KPIs for CBOs. So how do you set key performance indicators or KPIs for CBOs or any organization? When we talk about the key performance indicators, and most people who are in corporate or maybe in organization will tell you that everyone working in an organization has to have their key performance indicators, the KPIs, individual KPIs, organization-based KPIs, and just the general KPIs. And each and every time, even for your own case, when a year starts, every now and then, people normally have their own KPIs. Before the end of this year, I want to do this, this, and this. By the first quarter, I want to do this, this, and this. By half of this year, I want to achieve this, this, and this. So when we talk about key performance indicators, we are referring to few critical measures that tell the story of your project success. They give you more of an overview of the project success. So these are just your must track metrics that you need to track, you need to measure, and they vary depending on the focus area. One, for example, in education, a KPI might be school attendance rate. Is it increasing or reducing? As the manager of that particular institution, you have to be very worried if this is reducing. That's a KPI. In health, you can have a KPI like the vaccination coverage and the extent of how that has been covered. Is there a reduction in the disease incidence or there's an increase? As a health professional, that has to worry you, and that's a KPI. If we talk about economic empowerment, for example, we talk more of the number of small businesses that have started after a given period of time or after a given training. And maybe we can also even talk about the increase in household income. If that is increasing and you're a trainer for these VLSAs, or maybe those small groups, then you also have to be worried about that particular indicator, because that's what's going to measure progress of whatever you're doing. So the key is to measure everything, but measure what truly matters. When I normally talk about M&E, I normally try to advise people that when measuring success, when having any M&E framework, try to measure what actually matters. Is it making sense? Is it having any value? And is it data-driven? But is it measuring? And for what particular period of time? So KPIs help you to the team to stay focused, because you are able to track your progress in the meaningful way in terms of looking at your results, and they are equally data driven because you have different set of indicators that you are looking at. And it also gives donors that and stakeholders that clear picture of the impact that is being given just at a glance. So when let's look at the indicator development for especially a health CBO project, for example. That's a case study in this case. So let's make this real with just a simple case study by just giving an example. One, we are imagining here that we have a project whose goal is to improve maternal and child healthcare in a rural community where maybe you live. And the first objective should be, we want to increase the number of pregnant women. We have to increase the number of women attending prenatal care. Increasing that number, that's an objective. Another objective is to improve access to skilled birth attendants. Two objectives. Our goal was very broad, improving maternal and healthcare. But we have two objectives. Now, what are the indicators? Our output indicators here will be the number of pregnant women who attend at least 4 prenatal visits. Because if you attend these visits, then you are precisely sure that you are going to at least improve the maternal and the child health. And we're going to increase the number of women attending to this and access to healthcare. What is our process indicator? Process indicator is the number of training sessions that have been held for midwives. And our outcome indicator here is the percentage reduction. Outcome is more of a result driven. It's now the percentage reduction in maternal mortality. And our qualitative indicator is more of a session, more of being thoughtful, is more on percentage of women satisfied with the prenatal services. Here we need to do a survey and we get their perception ratings on how many are satisfied with that prenatal services. So if your baseline shows more on maternal mortality at 400, for example, per 100,000 birth lives, live births, then your target is just to reduce more by, let's say, even 300 by the end of a project for a given period of time. That example just shows how indicators connect your goal to your real objectives, to your indicators, and now to your results that's now trackable within that particular range. Let's also look at the data collection tools for M&D. There are a number of data collection tools, and the main method that are being used to collect data are the surveys, the focus group discussions. We also have interviews and also observations. Surveys are always great because they are used for collecting data from large groups. And let's say you want to collect data from 500 sample, 300 sample households about water usage after your clean water project. For focus group discussions, these are more on, conversational in a way because they provide rich, they are qualitative in nature, rich, detailed insights, the why, the how, but you do it in a group of discussants. 8 to 12 group of discussants. There is a mini FGD and a full FGD. A mini one has 4 to 6, and a full FGD has 8 to 12 discussants with a given in a given setting to answer to a given topic. Then there are key informant interviews or interviews. These are perfect for one-on-one discussion. There's no, we don't have a number of people, but they are good for interview. Then there are now observation, things that you see, just watching them happen in real time, such as just attending a session, just to assess more on participation, how are people being engaged, how are people responding to questions, more on an observation. So each method has its strengths and also have a mix of the weaknesses. So that can be looked broadly on some of the areas on how we collect data for those particular areas. So there are also tools and softwares for managing M&D for CBOs. And when you talk about the tools and softwares, we look at more on, for small CBOs, some of them normally use the Excel and also Google Sheets. That's for a great starting point because they are very free, they're easy to use, they're equally perfect just for organizing and also for analyzing basic data sets. But there are other mobile-based platforms called Toolbox, called Honor, Magpie, SurveyMonkey, Survey CTO. We also have Kobo Collect. So these are mobile embedded data platforms that are they're offline. You can collect data with them offline. You can try to connect them to your phone or your tablets that they are built for fieldwork and also for areas with limited internet. Then we now also have tools for large data sets, like now there's Stata, we have SPSS, and they have different versions. There's Stata version 16, 14, 12, 10. We also have SPSS from 25, 23. Right now we have 27. So you connect both of them. Then we also have platforms now you can use to do graphs and graphics. And for reporting, more on Power BI, more on you can use Power BI for dashboards. You also have the Tableau that can help you turn numbers into compelling ways on how you visualize them into charts and you communicate. Then what I'd like to inform you that you start simple, but as your CBO grows, then you can move into a more advanced tool. Remember that a good data management doesn't depend on expensive software, but it depends on the clarity, a consistency, commitment, and the accuracy at which that data is being collected. Let's also look at some of the ethical considerations in data collection and generally in research. And when we look at the ethics, we normally say in research or in applied research that ethics is the art of good M&D. And as CBOs, we often work with the vulnerable population. So we have to collect data and use data in a very respectful way. And also, we also value the human dignity. So first, try to ensure that there is informed consent. And when you talk about informed consent, here is more on the participant just being able to clearly understand what you are collecting, what data is it for, how will it be used, and that participation is very voluntary. And you don't need to compel them to participate. Then try to maintain confidentiality and anonymity by just avoiding collecting names and identifiers anyhow, unless they're really required and they're very necessary. So try to use codes and unique identifiers like IDs. Instead, try, for instance, instead of saying Boaz or Dawa, just use respondent 01 or respondent 1 or respondent A1 instead, but collect the data from that particular respondent. Third, try to practice the do no harm principle, whereby you avoid asking triggering questions that can put somebody at risk in terms of being violated both psychologically and even physically. And also try to ensure that there's a little bit of understanding of the cultural sensitivity. Be sensitive to the culture. Use local language if necessary. Try to respect customs and try to engage the local leaders in a respectful way, because that will be appropriate. You are using the right channel. The next is how do we use now M&D for decision making and also for reporting. And here, once the data has been collected, we try to now focus on the next big thing, making sense of that particular data. You can collect data, you can have data, but if that data can be translated to an information that is useful, then that's just another data that has just been collected there, and stories that can't make sense. So try to collect more information, and that data has to be translated into an information. And start by doing an comprehensive and a very intensive data cleaning. So already the first step when it comes to now analysis. Check for missing inconsistent values, whether there are duplicates. Something like an ID shouldn't be duplicated. We should only have one ID. Phone number shouldn't be duplicated. Should only have one phone number per given ID. So try to look at those particular things before you now delve more into the data analysis. So now when you move to the data analysis, there is always the two forms of data analysis, the two aspects. There's the quantitative analysis that summarizes the survey results into percentages and also into averages or numbers. Then there is also the qualitative analysis that doesn't talk more on numbers, but focuses more on reading the interviews, reading the focus groups, and just trying to take notes of the key themes, the key patterns, and how many respondents mentioned the lack of maybe market access or the challenges. We look at the how, the why, and the when those particular things happened. Next slide is on the M&D findings to stakeholders and how do we report them. And now here, when you talk about how to communicate your findings, you already analyzed the data, you already cleaned it. Now you have the findings. How do you communicate it now to stakeholders? Because a good data might lose its power if it's not shared effectively. How do you share that particular information to make sure that it's still relevant and resonate well with what is intended to be captured? So when reporting, always try to tailor your message to the audience. Try to understand your audience well and know what they need or what they want to hear. For community members, for example, keep it very, 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 very simple. Try to use stories by just storytelling. Try to use visuals. Try to use examples or a photo. If you have children, try to use visuals, photos, and try to make it very participatory. For donors or partners, try to include clear data because there is the aspect of verifying that particular information. Try to use charts. Try to talk about issues like the ROI, the return on investments, the explanations on what happened, how they happened. Try to show how the resources translated into some of the tangible results by using your outcome indicators. But the most important thing is the visuals. They go along the way. Try to use the good pie charts, well designed, well formatted, trend lines, infographics, that to make the complex information data be synthesized by the somebody that can easily understand it and synthesize it easily. Don't forget to include also the success stories, because nothing is more powerful than having a human face or that tailoring into a human way of understanding it beyond the numbers. Try to also include the success stories of things that happen. What are the challenges and the best practices in M&E for CBOs? I've tried to list them here. And of course, it's not easy, always easy for CBOs. They often face a number of practical challenges when it comes to M&D. And the first one is the limited financial resources, finance. Many organizations will simply can't afford the advanced tools or the regular field visits, or even ways on how they can go to the field or maybe evaluate higher external evaluators. Second is a lack of skilled personnel. Staffs may not be fully skilled in some of these particular softwares, so they need to be skilled in analysis, in cleaning, in reporting, and also in all other indicator development, M&D frameworks, and etc. Data collection difficulties is also an issue because some areas are remote, are insecure, and sometimes there are cultural barriers when it comes to getting it to get the accurate information. There's resistance to M&D, and staff, for example, or the committee members may at times see it as an extra work or even mistrust you in the entire process. Then lastly, there is inconsistent monitoring system where the CBOs might not have the standardized tools and also may find it hard to track progress over time. What are some of the best practices? Here, there are a number of best practices, and there are practical solutions that have worked well for some CBOs, such as capacity building their staffs, the training them, even having a short, low-cost online courses. We have ones like some courses like the Coursera. We have the Udemy, Philanthropy University, the UN learning platforms that can provide easy to digest courses for staff. Partnership, they collaborate with the research institution, the universities, the NGOs, the volunteers, just to access expertise where need be. Then there is also the bit of engaging with the community, the local leaders in data collection. That's for the community to own that particular project and to avoid that particular resistance. There is also implementing in phases, starting small, measuring few key indicators here and there, trying to expand it as you grow. And this just allows you to now build confidence, learn along the way, and without knowing, you are there and now you have a sustainable M&E. How do we leverage limited resources for effective M&E? And here we start by first prioritizing the key indicators. The way I said, we focus on the 3 to 5 most important ones, stick to them, track them, and give them high quality indicators that can provide dozens of that can replace dozens of inconsistent ones. Then next, try to use free or low cost tools like Google Sheets, Kobo Toolbox, the free SurveyMonkey that can handle the most basic things that even transit to the most expensive one. Then volunteer support, try to encourage the local university students to assist you in the data collection, build skills, and also just try to support, encourage them to support your work. Data quality and not quantity. Try to combine the two, have the triangulation, the mixture, quality, and also the quantity, so that you triangulate the two and you have a quality and also an accurate data set. Leverage technology. Technology is there. AI is equally there. Try to use those platforms well, but ethically, to ensure that there's creativity and also the team can equally collaborate well. Sorry. Apart from that, on leveraging limited resources, I think this is now my last slide. There's the Open Data Kit, the ODK, that can work well in ONA, it can work well in Kobo Collect, it can work well in WhatsApp, just as a link to collect survey responses. But even without using the ODK, there is also the Google Sheets that equally can collect responses. But the good thing with ODK is that you can collect responses in even hard to reach areas. We've now come to the end of this particular session. I wanted to give you 10 minutes as a Q&A session. And I want to sincerely thank you for your attention and also your participation for this particular presentation. Today, we walked through the entire M&E cycle, and just from defining the M&E, understanding it, setting the SMART objectives, and also developing indicators, collecting, analyzing data, and lastly, overcoming challenges and also making the most of the limited resources. If there is one message that I'd like to you to take home or as a takeaway, is that M&E is not just more about accountability. It's more on learning, improving, and also providing your impact. When you integrate M&E into your everyday work, then you don't just measure success. You build it. But measure what matters. Thank you, and back to you, Tim.
Wow, that has been an amazing session. I've really learned a lot, Boaz. I personally, I've been struggling with how to develop your indicators. And we normally give, as at WMI, we normally provide seed grants and growth grants to our applicants to start up small businesses or even community-based organization. And some of the key things that we look at when you're reviewing these applications is the monitoring and evaluation, the indicators, what they've put through to monitor the success of their projects. And today I've learned that these indicators, even with the CBO, they must be smart. And just to maybe understand, from your presentation, you mentioned that the indicators should relate to the goals and objectives, and that they should be my question is, when you're developing the indicators, must they all be quant, or must they all be qualitative or process outcome, or must they all be combined? Because we need to have at least 10 indicators when you're developing your M&E strategy. Boaz.
Yeah, I'd prefer, when we talk about indicators and when developing now indicators, one of the key things that I like to mention is that it depends, majorly it depends from your goal, trickling down to your objectives. What are your key objectives? The key objectives, if there are two, then ask yourselves, do I need a process indicator or an outcome indicator or an output indicator? The first thing you'll realize is that in most of the activities that normally do as CBOs, the output and outcome indicators are very important, because during that particular process, we'll have the process indicators, because we'll be having activities that we are implementing. We'll have to measure them and also track them within time, the output indicators. What are some of the outputs? But later, for these particular objectives, we must have a result. And we must also measure that particular result. That's where we now have the outcome indicator. So it is more of a threefold approach: the goal, the objective, and lastly, the indicator. And if your goal is broad, then the objective will try now to synthesize it better. But now the indicators will now narrow down into being a smart one. Measurable, time-bound, and equally very realistic. They are all very important.
Yeah, and I've also noticed most of the applicants, they always give unrealistic targets or unrealistic outcomes. Let's say they will achieve at least 200% profit, which is you can easily tell that this person has not done the needs assessment very well. You've talked about the softwares, you've talked about Kobo, you've talked about NVivo and all that. Just wanted to ask are these softwares free, or how can we access this software to analyze our M&E data? Or
Yeah.
to collect tools, sorry,
Yeah.
to collect tools, sorry.
Yeah. Before even looking at the software, the key thing that we need to ask ourselves is, are our data collection tools really responding to these particular softwares? Because if I'm having a survey platform, then ultimately I love to look for a quantitative software. And looking for a quantitative software, I'll start with the free version of a quantitative software. The first free version is the Excel platform, the Microsoft 365, very free. And you can actually do your basic quantitative analysis in there. There is also the SPSS, that's equally very free. There is the paid version and also the free one. There is Theta 16, equally very free. There's R for quantitative, equally very free. But there are others like Snowflakes that are being paid and that are very expensive. Now it's being used for big organizations. When you talk about qualitative data analysis, we have NVivo, which is very expensive and you can't access. We have Atlas TI, equally very expensive. But we have Max QDA, we have QDA Miner, and we have RQDA that are very free, and you can actually use them for analyzing qualitative data. Of course, the observation you don't have to analyze, but we use the nature of our eyes and make inferences and also perceptions based on that.
Mm. That's very insightful, boss. Thank you very much. We do not have any questions from the participants, but I can read a comment here from Shailene. She says, "Thank you so much for the good presentation. I really have learned a lot, and indeed, we have learned a lot. We really appreciate you taking us through step by step in M&E and how to analyze M&E data. And you're very clear and very, very knowledgeable. Really want to appreciate you. Maybe just to give you a minute to give a vote of thanks. Yes, I'm seeing Precious also saying this was so insightful. Thank you, Precious and Shailene, and all those who have commented. Maybe just Boaz to give you a few minutes to give a vote of thanks, and we wrap up the session today.
Yeah, I'll not have much to say, but just to thank the entire team for giving me this particular opportunity. I feel very honored and equally very grateful for having an opportunity to showcase some of the skills and some of the things that I've learned. And I'm actually very free to being invited once more just to unpack M&D into deeper sections and looking at some of the analysis that we can't talk within an hour, but we can have a different session for that particular area. But thank you, team, for joining, listening, and also just giving and listening ear this particular evening. I really appreciate and don't take that for granted. Thank you.
Thank you so much, Boaz. And on behalf of the WMI team, we'd like to appreciate you so much for accepting our invitation and honoring to take us through this session today. We really appreciate you for that. And to our scholars, we want to also appreciate you for taking your time to attend this webinar. Without you, we wouldn't be having this academy today. Just to appreciate you so much for taking your time and joining in, and your contribution really help us to strengthen the services that we provide during the online academy. And also to our tech support Liz on the background, we want to appreciate you for being there with us throughout this WMI academy, and all the planning team as well for the good work they're doing behind the scenes. And with that, I would like to call it to the end and wrap up today's session. Thank you so much, everyone, and have a good evening.